Hi, my name is Brandy Schantz, and you're listening to Living Chronic. This is a new podcast focused on learning how to live with a chronic illness, advocate for yourself in the medical industry, and truly live your life the way you want to, despite having a chronic illness. I thought that it would be best if I started this by telling my story. Almost 10 years ago, I was finally diagnosed with Crohn's disease. I had been experiencing the symptoms of Crohn's disease for some time, but it did take doctors quite a while to finally diagnose me with Crohn's disease. Once I was finally diagnosed, we started looking for a treatment, and as any other IBD patient can tell you, it's not always easy. It's not always the first medication you start on, and often the diagnosis is just the first step. It took quite a while for me to finally get into remission. Well, at first, I was able to still live my life in many ways. I did change careers. I could not work in a skiff any longer. That was just impossible for me at the time. My job required me to do everything in a skiff. That's a secret facility for people with top secret clearances. That's where you do your work. You can't take anything home. Nothing leaves the skiff. I was experiencing symptoms every single morning, so getting out of the house proved to be quite difficult. Of course, this was 2013 also, so nobody was working from home. But even if we were, just even the name of the program I worked on was top secret. So there really wasn't much I can do, and I recognized that. I did know that I could still work full time though. I knew that I could still contribute, so I became a realtor and I founded my business, Schantz Group. We do sales and investments. It was a really great way for me to continue working and to do things on my terms. I had a very flexible schedule. I scheduled my days so that I would do all admin, phone calls, things of that nature from home in the mornings. And then all of my appointments, meetings, things that required me to leave the house, I did those in the afternoon. And that worked for me. I also was able to continue running, which is my passion. I'm always running. It brings me a sense of peace. It brings me a sense of joy. If I'm having a really bad day, I know that a run will make me feel better or at least clear my mind. If I'm having a great day, then a run just makes it better. I even was able to do some triathlons during this period. Unfortunately, I just still was not completely in remission. Around 2016, mid year, things started to become much worse for me. I could feel my Crohn's becoming more severe. I was experiencing more severe pains. I had an inability to do the things I used to do. And by the time I got to the end of 2016, I was finally competing in my last race of the year. That was Ironman 70.3 North Carolina. I barely made it across the finish line. I remember being so thankful that they handed out pajama pants back then because I needed them. From there, it only got worse. In 2017, I woke up one morning and tried to go for a run, something I've done every day for years. That day, I got across the street and collapsed. That started about 2 years of true hell for me. I was doing everything I could, going to every doctor. I tried every single possible diet, the elimination diet, the autoimmune protocol diet. You name it, I was trying it, and it just did not work. I finally decided to switch up doctors because I was not getting anywhere and I had completely lost everything that I loved. I could not run. I could not bike. I could not swim. I couldn't get up to go to work in the morning. The fatigue was so severe, I would just fall asleep anywhere, on the couch, on my computer, Sometimes in the hallway, my husband can tell you stories about just covering me up, making me comfortable because I would fall asleep wherever. Finally, I got to a new doctor, and that doctor decided that I should up my Humira to once every single week instead of once every other week. And finally, it did work. I was starting to feel better. There were fewer nights that I was up with the pain. I was starting to eat a little bit more normal again. I was really starting to feel like myself. So much so that I decided to jump back into training. And I signed up for all the races in 2020. I was going to do Ironman 70.3 Chattanooga. I was going to revisit Ironman 70.3 North Carolina and really triumph with that one because that one I really wanted to do again. I failed so miserably the last time just because of the Crohn's. It was something that meant something to me. So I started training and training hard. And that's when, in February of 2020, I started experiencing fatigue, severe muscle pain, and inability to exercise. Being an athlete, the first thing I thought was I must have overtraining syndrome. For those of you who don't know, every athlete out there knows all about overtraining syndrome. It's pretty easy to get into. You overdo it, you maybe do too many workouts, too hard. I had been doing two different indoor cycling classes, one with a world-class cyclist, which was very difficult. And certainly it was improving my abilities. But I was also doing another difficult class with my triathlon coach on Saturday mornings. So between those two things, my running, all the strength training I love to do, I thought, why would this be anything other than overtraining syndrome? So I worked with my coach, dialed back the intensity, dialed back the volume, and I really did a great job of resting and relaxing, which is difficult for me. I'll run through anything. But I did what I was supposed to. And unfortunately, those feelings just didn't go away. I had sharp pains in my quads that felt like I had ripped them. And I just could not get back out no matter how much I rested. Unfortunately, that coincided with the pandemic and the lockdowns. Being immunocompromised, and all of my fellow immunocompromised people remember this, I was flat out told, unless I'm dying, don't come to the hospital. Don't make an appointment with a doctor. We don't have time for this. So I stayed home, waiting, trying to figure out what to do next. And that's when some of the other symptoms began. I had shortness of breath that just came up out of nowhere. I'm still having difficulty running. I've given up on cycling and swimming. Can't even go anywhere to swim, but I can still run. But it was difficult. And then I started having the shortness of breath. This is not something that a runner expects to happen. I got in my car, drove down to the little COVID line so I could get my test. I tested negative, so that wasn't COVID. But it still felt like I was gasping for air. And then the chest pains began. And at this point, I realized I need to go see my GI. That's the only thing that's ever been wrong with me. I'm a healthy person. If you look at my health record, other than having Crohn's disease, I'm actually extremely healthy. So it never even occurred to me to go anywhere else. I went to my GI. And he said that the inability to exercise wasn't his problem. The shortness of breath, he doesn't think that I would just suddenly develop asthma at my age. I'm in my mid 40s, by the way. And he thought, maybe it's nothing. Maybe it's just GERD. So I got a prescription for GERD. But it persisted. The prescription wasn't helping me. I still had the chest pains. I still had the shortness of breath. I still had the inability to exercise. And then things started escalating. I started getting numbness and tingling in my arms and legs. I also started getting more severe chest pains and shortness of breath. And that's when one day I thought, oh my goodness, I'm having a heart attack. And I did go to the ER. No surprise, they came back and said, well, you're healthy. As a matter of fact, you were an athlete. Yep, No kidding. I'm an athlete. Why is this happening to me? But there were no answers. I did all of the heart tests, came back perfect. I took a test to see if I'd become asthmatic. That came back negative. But the pain in my chest persisted. The numbness and tingling in my arms persisted. My legs. Then in February of 2021, things went downhill very fast. I was at least doing some running, even if it was not what I used to do. And I think that was part of the problem. And it's certainly something that I've thought a lot about and we'll be talking about more on this program. Doctors are not used to athletes. They don't know anything about exercise science. So when I said I was still running, they just shrugged it off and thought nothing's really wrong. Never mind the fact that I went from training for an Ironman at a very great pace to slowing down my run, my body suddenly just stopping for no apparent reason. I had no exercise science explanation. I just stopped. They just had no explanation for that, and it didn't seem to concern them. But then there was February 2021. I could not run at all. My slow pace that I slowed down to was around an 8:30, 8:45. Suddenly I'm doing a 10 and a half minute mile and it's painful and I can only run maybe 5 minutes and I have to stop. For probably 2 to 5 days after that attempt at running, I wouldn't be able to move. I couldn't do a back-to-back workout. I could not even attempt to run 2, 3, 4, 5 days after that workout. It was too painful. And things started getting worse fast. We love to spend time outdoors. We have a boat. I'm always outside running, walking the dogs, whatever it may be. And all of a sudden, as soon as I went outside, I started getting a rash all over my neck and chest from the sun. Something I've never had before. The muscle myalgia, that tightness, continued to get worse. I kept going to see a massage therapist. She would work on me, and an hour later, I was just as tight and knotted as before I got there. I felt so terrible because there was just no way for me to explain that it wasn't her fault. I just couldn't get rid of the muscle tightness. And it continued until I eventually lost my ability to walk. As I was going through this in 2021, I realized these doctors weren't helping me. I kept going in to see doctors. I heard the same thing every time. You feel like you're in overtraining syndrome? What's that? We don't know what that is. Or, well, your blood work came back normal. You must be fine. I clearly was not fine. I was not okay. In addition to all of this, I was having severe mood swings. I was experiencing suicidal thoughts. And I just had the worst depression. I can't even explain how desperate I felt. I was spending every day calling doctors. One, trying to find doctors that I could get in to see. And two, calling doctors trying to get in to see a mental health care professional because I wasn't okay. And I knew that. That was one of the most difficult things I've ever been through. I had to do all of my own research. So here I am reading journal articles. I do not have a science background. I'm not just not a doctor. The only science courses I even took in college were exercise science. So it took me hours, days, weeks researching everything I could, calling doctors, demanding certain tests be done. The weights, 2021, every doctor I tried to get an appointment with, 3 to 6 month wait, or they weren't accepting new patients at all. I finally started getting in to see doctors, and it was the same thing over and over. I see nothing on the blood test. I finally got in to see an endocrinologist, and he ran the battery of tests he knew the rheumatologist would run because I couldn't get in to see a rheumatologist for another 2 months after this point in time when I was seeing the endocrinologist. One of the first things that struck me as I'm coming into this man's office with a cane, can barely walk, in severe pain, and he says to me, "Your blood work's fine, but I'll believe you that something's wrong because you were an athlete and you're fit and in a great weight place. Most people come to me and they're just fat and lazy, and I just have to tell them to get off the couch and stop eating chips." That was the first moment where I really realized that as difficult as it was for me, it would have been even more difficult had I not been an athlete. Even though they didn't understand what I was saying, even though they didn't understand how to treat an athlete, they at least believed me because just a year earlier, 2 years before that, I had been training for these high level races. I finally get in to see a neurologist. I have these tinglings in my legs and arms. I think this has got to be neurology related, possibly. The neurologist listened to me. This was a virtual appointment. He listened to what I have to say, and then he said, "Well, let me take a look here at your chart." Within not even a minute of him looking down at my chart, he looks up and he says, "Why are you on Humira?" And I told him I'm on Humira for my Crohn's disease. And he said, "Well, we have to eliminate it as a possibility. This sounds exactly like a reaction to your Humira." Well, this was late September 2021. I did not take my next dose of Humira like I normally would. I used to take it every Friday. A week after that skipped dose, I got my ability to walk back. 2 weeks after that skipped dose, all of my sun rash was gone. My mind started healing. I immediately felt better. And just over a month from that point, I got my ability to run back. Even if it was just short runs, it was back. Now, it did take 6 months to fully get rid of the drug-induced lupus. Although I still have some symptoms and I'm still not myself, the 6 month mark, I was able to run without hurting myself, having the sharp pains in my quads, the inability to run a second day. I'll never forget the first time I was able to run back to back days. It was after that 6 month mark, and it just felt like such an accomplishment. I wanted to do this podcast because what really hit me about all of this, when I would tell people what I went through, rarely was there a feeling or any kind of expression of shock. They understood because they've been through it themselves. First, I met countless people who said, "Oh yes, that sounds just like what I went through. I was diagnosed with type 2 diabetes and I actually have type 1. It took 15 years." Or, "Oh yes, I was on a biologic and was having symptoms and it took doctors 2 years to diagnose my reaction to the biologic." Or, "Yes, it took me 10 years to finally get my multiple sclerosis diagnosis." The stories were endless. And I knew I was not alone. I'm not alone still. People go through this every day. And yes, some of us have a little bit more fortune than others when it comes to them at least believing us. As I said, when I saw that endocrinologist, he made it clear. If I had been fat, he would have just dubbed me lazy and told me to get up off the couch and lose weight. That was not my problem, obviously. I'm having a reaction to my biologic medication, Humira, which is something that every one of those doctors should have known. No one looked at my medication list and questioned what might be causing this. One doctor. I look back at it and it's just amazing. He was the 13th doctor I saw. I had also seen 2 nurse practitioners, physician's assistant, countless RNs, no one looked at my medication list and questioned what I might be going through. What's more interesting is I have had no problems whatsoever in finding my own support group of people who have been on a biologic and suffered drug induced lupus. So I've been told by doctors, attorneys, over and over again, oh, it's so uncommon. Who would have ever thought you would get drug induced lupus? Well, it can't be too uncommon because I keep meeting people who have experienced it in my own life. My neighbor came to me one day and said, "Didn't you go through drug induced lupus?" And I said, "Yes, I'm still recovering." And she said, "Would you please speak with my friend? She's going through it right now." This is not that uncommon. And as chronic illness patients, as people, as humans, it's so important for us to learn how to advocate for ourselves in the medical community. There's no reason anybody should go 19 months without a diagnosis. And I've learned a lot over this time. I've learned how to do better research for somebody who is not a medical professional or even with a science background. I've learned how to stand up to doctors because they don't know everything. I understand they pretend to sometimes, but what we have is a medical institution overall in the United States filled with doctors who aren't willing to just say, "I don't know." Or, more importantly, look outside of what they have in their toolbox. Biologics, we all read the warnings. I read the side effects. I was fully expecting lymphoma potentially. This was not outlined for me. And in my research, I found a lot of other people who had the exact same symptoms I did. So it's really appalling that doctors are not required to understand all of the reactions possible with a drug that they prescribe, and frequently. Every GI doctor and rheumatologist out there can tell you they prescribe Humira frequently. They prescribe biologics, TNF inhibitors frequently. They should know how to identify that reaction. I lost 2 years of my life, and the only thing anybody will say to me is, "Oh, well, it happens." So that's why I wanted to start this podcast. It's because people weren't necessarily surprised at what I went through. There are many of us who deal with this day in and day out. So I want to do something for us. I want to do something that we can really learn from, all of us. So I wanted to start this podcast so we can discuss our own experiences, really dive into how to advocate for ourselves in the medical community, and hopefully make some change policy-wise, within hospital administration, maybe even just among doctors who might listen to the show or hear our stories, to understand that they need to understand how patients are dealing with the medications that they prescribe, how patients are trying to live their life. It's not enough to just be alive. I don't want to just be alive. I want to live. And that's what we need doctors to understand and hear, that we need to be able to live. So as I film this podcast, I'm going to be interviewing friends of mine who are also fellow chronic warriors. I'm going to be interviewing doctors, attorneys, people from all walks of life who have experienced trauma, chronic illness, misdiagnosis, and who are doing their best to try to live their best lives. And hopefully, my experience can help some others out there. And hopefully, my experience will make some people think. And more than anything, what I want to come out of this podcast is change. We need to make change. We need to make life better for chronic patients, for our families, for our friends, for our loved ones. I always ask the question, what do you wish you knew when you were first diagnosed with a chronic illness? And I'm going to ask that question a lot throughout this podcast. There's a lot I wish I knew, and I'll touch on all of those things in various episodes. The number one thing I wish I knew was how to advocate for myself, how to say, no, no, doctor, you're not the expert. There is something wrong with me. No, doctor, we need to change this. I can look back over 10 years and identify very clearly many, many moments where I should have pushed back against the doctor. Humira was actually one of them before I even started that journey of the drug-induced lupus. I remember telling my doctor multiple times, this is not working. I'm getting better, but I'm not good. I still can't live my life normally. I don't feel well. I'm constantly ill. I have these issues. And I was brushed off and told, no, it's not the Humira. You're fine. It's just in your head. Well, clearly it was not. So hopefully my experience can help somebody else to not just sit back and let a doctor tell you it's in your head. And we're going to go through all the things that I did to advocate for myself. And hopefully that can help even just one more person to advocate for themselves and get that diagnosis, to identify that reaction, to get a better drug. Because we all deserve better. Thank you for listening. This is Living Chronic.